7 million U.S. children, or about 9%, have no health insurance. Community health workers are known to be effective in insuring uninsured children, and parent mentors in improving outcomes for asthmatic children. It is unknown, however, whether a training program can result in parent mentors acquiring the knowledge and skills needed to insure uninsured children. Our study aim, therefore, was to determine whether a parent mentor training program results in improved knowledge and skills regarding outreach to and enrollment of uninsured Medicaid and CHIP eligible children. As part of a randomized controlled trial, or RCT, of the effect of a parent mentor intervention on insuring uninsured minority children, minority parents in an urban primary care clinic who already had a child covered by Medicaid or CHIP were selected for the RCT based on interviews. In this program, called Kids Help Program, or Kids Health Insurance, by educating lots of parents, parent mentors underwent a 2-day intensive interactive training session addressing 9 topics. These included why health insurance is such an important issue for America, Kids Help, a community-based program to help the parents of uninsured Medicaid and CHIP eligible children obtain health insurance for their children, being a successful parent mentor, parent mentors' responsibilities, the Medicaid and CHIP programs, step-by-step instructions on completing Medicaid and CHIP applications, the next steps once insurance is obtained, what are medical homes and why are they so important for children's health and health care, and the study paperwork. A 33-item pretest was administered prior to training to assess knowledge and skills regarding Medicaid and CHIP, the application process, and medical homes. A 46-item post-test was administered at training completion with the same 33 pretest items ordered differently and 13 Likert scale questions on satisfaction with training. The Kids Help Parent Mentor Training Program resulted in significant improvements in knowledge and skills regarding outreach to and enrollment of uninsured Medicaid or CHIP eligible children with high levels of satisfaction with the training. This PM training program might also be a useful model for training ACA navigators.